Videos are prominent learning materials to prepare surgical trainees before they enter the operating room. However, the surgery video watching experience has mostly been passive, where the viewers have limited opportunities to actively engage with the video content and receive feedback. Prior work to enhance video learning experience is insufficient since they focus primarily on extracting the procedures in a task, instead of discerning components in the image frames. Moreover, these techniques do not easily generalize to learning surgery videos, which involve subtle scene changes, such as the cleaning of a small vessel. Existing work on question generation are primarily text-based, and automatic visual question generation techniques often produce simple questions like counting objects in a scene. Our formative study reveals that surgeons relied on visual cues in the video to identify teachable moments, and one of the most time-consuming tasks was searching for image frames that met certain criteria. Surgeons frequently annotated the images to both create the questions and give respondents feedback, such as verifying if all criteria for a critical view of safety had been met. Surgeons showed significant interest in creating questions about anatomical structures, for example, cystic duct identification, instrument handling, such as choosing the right tool, and operation procedures like selecting images with adequate exposure for dissection. We present Surgment, a system that helps expert surgeons quickly search for images of interest and easily create high-quality visual questions with feedback for surgery videos to enhance trainees' learning experiences. We first propose a few-shot learning pipeline to segment surgery scenes, combining the Segment-anything model, which accurately differentiates regions, and Seg-GPT, which makes class predictions for the segmented regions. Seg-GPT result contains some mistakes and only predicts the class of each pixel, not distinguishing the items in the scene. SAM instead divides images into sections, but they are not classified, and there are too many small pieces. We thereby combine the two methods to correct the mistakes of Seg-GPT, as well as merge some small sections in the SAM result. A technical evaluation showed that the Seg-GPT plus SAM pipeline achieved an F1 score of 0.92, better than the top-performing regression model baseline UNet, which had an F1 score of 0.73. The segmentation pipeline enables the main functionalities of Surgment. Surgment is a web interface. The left panel consists of a video, a frame gallery, and the Search by Mask tool. Users can select an image from the frame gallery, which opens the canvas of the Search by Mask tool with polygons generated based on the segmentation outputs. The users can then adjust the size, location, and shape of each polygon to sketch their requirement of an image they would like to retrieve. For example, if the user wants to identify frames with less fat occluded to the gallbladder, they can adjust the sketch like this. Upon submission of the sketch, the system will search in the video to fetch the frames whose segmentation maps are close to the sketch. The right panel is the question creation area. The default question type is multiple choice, which can be used to ask about operation flow and anatomy. Besides inserting text and images in the question stem, the experts are also able to provide visual feedback. As clicking Go to Edit, the users can click on the segmented components on the canvas, and a window for selecting subclass and action will pop up, thereby providing a sentence starter for the label. The trainees will receive feedback associated with each anatomical structure as highlighted. In addition to MCQ, the user can also create an Extract a Component question to ask about tool usage by removing the segmented tool in the scene, and a Draw a Path question to ask about the tool's motion or anatomy by drawing on the image to provide correct answer. We conducted an evaluation study with 11 surgeons to fully evaluate all system components. Here is a summary of the findings. Participants found that the Search by Mask tool addresses their need in identifying frames, and the results are accurate, promoting the efficiency of gathering image materials, while Sketch Search brings a heavier mental load as it has a learning curve. The surgeons commented that visual feedback is beneficial for anatomy learning beyond textbook diagrams, and it makes learning easy, engaging, and digestible. It also aligns with surgeons' mental model, as surgeries are naturally a visual thing. Drawing a path and extracting a component, those novel types of questions, not only resemble real questions encountered during surgeries but also enhance patient safety. Surgeons considered the AI segmentation outcomes to be accurate, but desired higher granularity in segmentation, like distinguishing the cystic duct from connected tissue. Please check the paper for more details.